Okay, welcome. We're letting everybody get into the room. So, welcome to the FSOMA Town Hall meeting about COVID-19 best practices. We're so glad you're here. Thank you. I'm Ellen Teeter, and I'm the Executive Director of FSOMA, and we have David Bibbey, our FSOMA Vice President, giving a presentation tonight. And Marilyn Allen will be on a little later with some information as well. There is a chat window, and I will be putting some links there to information, as well as responding to questions there. We have some questions that have been pre-sent in. We've got a lot of material to cover, so please remember that we're looking in the chat window for questions. And if people, while we're waiting for all the sign-ins, could just put a little note in and say who you are and where you're from, that would be great. I'm Ellen in Bradenton, so I'll get that going. And all right, got Sarah from Melbourne, Sean from India Atlantics, where my brother lives. Okay. Coral Gables, Washington, D.C. All right. Welcome. Welcome to everybody. Pensacola, St. Pete, they're coming in fast. I can't even keep up with them all. So
that's great.
Thank you all. There's Renee Ng from Sarasota. Punta Gorda, welcome. Okay.
Hi, David and Ellen. This is Marilyn Allen.
Hi, Marilyn. We're on live, so welcome. David's going to go through his presentation, and then I think you've got some slides on his PowerPoint at the end. So welcome, Marilyn from California. Well, I'm going to turn this over to David, and thank you all for signing in. And we'll let David start. I'm going to put a Dropbox link that will go to his PowerPoint and a PDF of it, and all the links that are on it will be in there, and all the materials that he's sharing with you are in that link. So I'll put that up in just a second. And David?
Yeah. Hey, good evening, everybody. I want to thank you for joining the town hall tonight. And I wanted to just provide a little outline to the material that we're going to cover this evening. And basically the subject matter is providing hands-on care in the age of COVID-19. And so our outline is going to cover government regulations and then office review and preparation. And this includes your COVID-19 infection control plan. That's guidance from the CDC. I've also had some guidance from the CCAOM on that as well. Personal protection equipment based on CDC guidelines. Disinfectants for the office, regulated by the EPA. Some risk management considerations, patient scheduling, screening, and care. Office maintenance, provider personal care. We have to watch out for ourselves here. And comments from Marilyn Allen, who is an industry expert. And I welcome any comments from Marilyn to either issues that she wants to discuss further or any errors and omissions. She has a fantastic global view of the industry as a whole, and I thought it would be important to have her input as well. And then lastly, I've included a number of practice resources that can be downloaded either directly from the PowerPoint if you download that, the PDF if you download it. If they won't open for any reason, those links get broken, just copy and paste them hopefully in your browser and they'll work. And we also have some downloads available from the Dropbox at the FSOMA website. So we'll just jump right in. And one of the things that I wanted to address early on in the question of regulation is that one of the major goals of the acupuncture profession over the last 3 decades is self-governance through voluntary compliance. And I underline those two things for a reason, because we want to develop and follow policies that comply voluntarily with regulation. And the reason for that is that if we don't, or any industry doesn't, then more regulation is required to control our behavior and force compliance. So we have to remember that healthcare and our work as well in acupuncture is a heavily regulated industry. So understanding and following regulation is a big part of our job. So how can acupuncturists provide hands-on care during the COVID-19 pandemic? Well, there's only one real requirement, and that is complying with government guidelines. So we look to local emergency management services, state, the governor's office, and the Florida Department of Health, as well as the Agency for Healthcare Administration, AHCA, and also guidance from the federal government, that's the White House, the Centers for Disease Control and Prevention, the CDC, and Occupational Safety and Health Administration, OSHA. These are the resources that provide guidance or guidelines. And sometimes it's clear as mud, and other times it's very clear. But I would suggest that at least in the early stages of COVID-19, there's been a little bit of tea leaf reading necessary in order to really understand how acupuncturists fall in the larger scheme of healthcare regulation, both in terms of providing, delivering care, and then complying with disinfecting and other policies. So let's just move through. Local government, FSOMA is not aware of any local order or ordinances affecting acupuncture practice in Florida. And if to be certain, you can check with your local county. There's a resource here that's from NACCHO org. That's a directory for local health department agencies. And let's see if that opens directly from my presentation. All right. So if you scan down here, you'll see this is an interactive map of the US. You can click on Florida, and it'll provide you the local directory for county and local health departments throughout the state. All right. So this is a resource. If you feel like you need to have some specific guidance from your local agencies, this is how you'd find them. All right. The from the governor's office, there's no prohibition on acupuncture at this time, or any. The only requirement is that you comply with the CDC and OSHA guidelines. So it's important that you know and understand what those are. The Florida Department of Health, same thing. Healthcare providers must comply with all federal, state, and local guidelines. And the Agency for Healthcare Administration, they provide guidance on healthcare clinics. And just an FYI, acupuncturist office are exempt from healthcare clinic licensure under section 400.99054. That's something you want to take a look at. Our offices are offices, and they're not regulated strictly as healthcare clinics, meaning that you're not required to have a medical director, you're not required to have a lot of the same compliance requirements that healthcare clinics must maintain. But you should be familiar with that. And the reason why I included it is that AHCA is the enforcement agency for the governor's executive orders. And if you just needed additional details on how that might affect you or your office, I wanted to provide a link for you to AHCA. So best practices from the White House, they provided guidance on phase 1, 2, and 3, opening America. And I think rather than opening these links individually with you guys, I'm just going to let you download the PowerPoint presentation afterwards. And you can, like I say, you know, visit those links to glean more information. The CDC also has lots of data and information on its COVID-19 homepage. And from there, you can spread out into hours of reading from link to link to link. I included at the end of the presentation a link resource with some of the, I think, some of the more important or related links that you might want to take a look at. And just as a linked resource, you can explore that when time permits. Same thing with OSHA has provided a wonderful document. It's for preparing workplaces. And again, I embedded it here, but it's also a separate PDF that's available. It's about 35 pages, and it's certainly worth, there's only a handful of pages that really specifically relate to some of the things that we would be interested in. You can tell by the table of contents which those are. But I think in terms of putting together a resource book in your office, and where you want to bring together some of these, this information, downloading and putting a tab in that book for OSHA and just including that 35 pages is an excellent resource, okay? Best practices with infection control. The CDC had its last big update on April 13th. And basically I pulled out some specific information here for us. And that below were the changes in guidance, because they've had the same standard guidance for a number of weeks, but in the 13th, they recognized that to address asymptomatic and pre-symptomatic transmission, they're recommending implementing source control for everyone entering a healthcare facility. And source control basically means that you're going to consider every person that you come in contact a source for COVID-19. So implementing source control would include putting a mask on that person or a face cover on that person, okay? And this applies differently to patients than it does healthcare personnel, and we'll get to that a little bit in a few slides. But the actions recommended to help prevent transmission from infected individuals who may or may not have symptoms of COVID-19, okay? Face cloths, coverings are not considered PPE because their capability to protect healthcare personnel is unknown. So face masks, if available, should be reserved for healthcare providers. If a patient or a visitor arrives at the facility without a cloth face covering, a face mask can be used for source control if your supplies are available. But ideally, you'll provide instruction to patients to make sure that they bring a cloth face cover or a mask when they arrive at your office. And then, of course, actively screening everyone for fever and symptoms of COVID-19 before they enter a facility. These are the updates from the CDC as of April 13th. And the key concepts here is that they want to reduce office risk by limiting points of entry, managing your visitors' movements, screening everyone before they enter the office for COVID-19 symptoms, and again, using your source control with a facial cover or mask for everyone entering, regardless of symptoms. The other concept here is that they want to identify and refer symptomatic patients, and either to their primary care provider, the ER, or a Department of Health clinic or facility that might be in the area. And it's important that acupuncturists develop and follow policies and procedures for identifying COVID-19 symptomatic cases and then refer them based on your plan. So we're making these changes and doing these things to protect healthcare personnel by emphasizing hand hygiene, conduct and document daily COVID-19 symptom self-assessment. This is on everybody in your office, as well as we discussed a second ago on for patients, but it applies to any staff and of course yourself. And then provide and educate staff about proper PPE, their indications for use, how to don and doff those materials, that equipment, and then installing barriers to limit contact with patients if needed. Not every office will require petitioning and other hard barriers or soft barriers that isolate and protect people. It just, you'll have to examine your office space and determine if anything like that is necessary. So office review and preparation. This is important that you use a critical eye to remove as many objects and materials from public areas and treatment spaces in your office. And the reason is the fewer things to touch, the fewer things to clean and disinfect. And so you want to plan and communicate exactly how staff and patients will physically move throughout the office. You want to have a plan for how that's done and establish the 6-foot social distancing areas using masking tape on the floor where needed. And then, of course, eliminate bottlenecks where people might gather or wait in a place together. Okay? And then determine the criteria providing hands-on care for Florida during phase 1, phase 2, and phase 3. So this last item here is something that we all want to consider before we just open the door to the office. You want to sit down and really determine the criteria, your criteria for providing hands-on care. And so it's a little bit different in terms of how the public is recommended to move around in phase 1, 2, and 3. And so you want to document that policy, and we'll talk a little bit more about that in just a second. But I also wanted to provide that there's a CDC reopening guide that's linked here as well, that often provides a little bit more specific in terms of resource for ideas and how to determine that, okay? So before we get into PPEs, and it's important we come up with a couple of definitions. And the first would be a healthcare personnel. This is all non-patients in your office. So anybody that's on staff or has a responsibility, healthcare personnel applies to all non-patients that are in your office, okay? Of course, that's if, that doesn't apply to family and other people, but as you'll see, we really want one person in, one person out of the office, depending on the size. You're not gonna have, you know, family, friends, unless it's a special circumstance where somebody needs specific assistance, and then all of the criteria for screening and whatnot applies to any person entering the office. So definition here of cloth face covering, this is a textile cloth cover that are intended to keep the person wearing one from spreading respiratory secretions when talking, sneezing, and coughing. And they're not PPE, and it's uncertain, as I said a minute ago, as to whether or not it protects the wearer. Guidance on design, use, and maintenance for cloth coverings is available. There's a link that's a recommended part of the FAQ, frequently asked questions, in the end of the presentation for guidance from the CDC on making your own face cloth, as well as making a face mask. Face masks, now we're talking about PPE, and they're often referred to as a surgical mask or a procedure mask, and they're not regulated by the FDA, such as some procedure masks, which are typically used for isolation purposes, but don't provide protection against splashes and sprays, okay? So PPE is something that you want to make sure you have a good understanding of the terminology and requirements for. Gloves, this is going to use a clean, non-sterile glove upon entry of the patient room or any kind of care area. Frankly, you want to have them on anytime you're in the office. And you want to change them frequently if they become contaminated, of course. And remove and discard the gloves when leaving a patient room or care area, and then immediately wash your hands. There's several other resources and guides where you're going to see this information over and over again. And I do recommend everybody take the time to read the guidance from the CCAOM. It's pithy, you know, they have a lot of information there, but it's not overly dense or complicated to get through. It'll be a good resource to go with our presentation tonight, but I'll let you review it separately, okay? So where are we going to find our PPEs? These are, I put in AccuMarket is letting us know that they have face masks and disposable gown options available. So does Laza OMS. And I had a member share a resource from Cove Care, COVCARE. They're based out of Staten Island, New York, I think. And they have both face masks, shields, gloves, and full disposable gowns, as well as, this is a little bit more robust in terms of its availability and variety of equipment available, much more what you'd see in a hospital setting, beyond just a mask and a glove. So I'd encourage everybody to visit that website. And I think one of the things that we want to be mindful of is, even if it's not necessary for patient interaction, you really should have at least one disposable gown, one shield in the office for an emergency situation. And even if it's never used, obviously it's part of your best practices emergency plan that if it is needed at any time, you have it on hand. That's the definition of being prepared, okay? And I also put in here, I spoke to the people at Cove Care. They have a promotional code, GLUCK, GLUCK, right there, good luck, for a 5% discount on all orders going to Florida, okay? And I included here a resource also from the CDC down the bottom. It's a PPE sequence poster, and that is a sequential poster to help understand donning and doffing. That's putting on and taking off your PPE equipment in a way that's most consistent with not contaminating yourself or your equipment. And similar to the process we all learned with clean needle technique, there is a procedure. First you do this, then you do this, then you do this, and you do it in a sequence for a reason. So there is a resource here for you to better understand how that equipment is supposed to be put on and taken off. COVID-19 approved disinfectants. Now, materials that are used to clean the office are not regulated by the CDC. They're not regulated by anybody else. They're regulated and registered at the EPA, the Environmental Protection Agency. And so the EPA provides classifications for disinfectants that are suitable for residential, institutional, and healthcare settings. So it's important that you choose a product that is recognized as approved for use in a healthcare setting. It's, it would not be helpful to your policy and procedure plan if you had a product on hand that may be effective at disinfecting in your home, but it's not intended for healthcare purposes. So we want to make sure that we match the right cleaning material for the right purpose. And then you also want to consider the application method and the contact time needed in order for that disinfectant to be effectively bactericidal and killing both, virus, bacteria, their spores, and to actually render it not just sanitized, but disinfected. So the application method could be spray and wipe, obviously. It could be a material that needs to be, it's a concentrate and then it's diluted. You have to understand the directions and then how to apply it to your non-porous surfaces. And then following the instructions for use, make sure that you have the required contact time with that non-porous surface to actually achieve the disinfecting that you want. And I have a PDF included here that is a resource from the CDC that provides a list of products they manufacturers, the contact time and the method of application, as well as whether or not the product is manufactured, advertised, and understood to be effective against COVID-19. And you'll see on the far right-hand side column of that PDF document the word yes. And yes indicates that it's for COVID-19 because it's a long document that includes lots of other disinfectants. But you, in the top maybe 20% or so of that list are the products that are manufactured and marketed and sold for disinfecting COVID-19. So a couple of options here for you. Several ready-to-use products like Clorox, and the product that they make is called Clorox Healthcare Bleach Germicidal Cleaner Spray is something I would, search that. It should be easier to find than some of the other industrial options if you're not doing business with an industrial supplier. But there are many to choose from. And of course, if you'd like a non-bleach option, two that stood out in my mind. One is made by Benefect, and they're a Canadian company, I believe, but they sell in the US, and it's basically a botanical daily disinfectant towelette that's used, I think its active ingredient is thyme oil. And same here with Thymox disinfectant spray. These are just nice options if you don't want to use a bleach product in your office. And I told you before, there's a full list of approved EPA products available for email or download right here from the CDC. I'm sorry. That's available as a separate download. You'll find it as a PDF. The CDC also has a reopen business guidance poster. It's something it's a small poster that's helpful to maybe print and put in your office, keep it as a reminder somewhere, as well as some frequently asked questions on disinfecting agents from the CDC. So these resources can be helpful just to, if you had additional questions about that. So now we get to the part where I want to say, what is my plan? You have your PPEs, you have your disinfectant, but what's your plan for patient office scheduling, patient COVID-19 screening, patient hands-on care, office maintenance, and I thought, before we dive into that big question, the first thing you need to decide as a provider is consider your office, its physical layout, the type of patient care you typically provide or that you typically want to provide, and then decide what is your risk tolerance. Because all of us, when we decide in the age of COVID-19, are operating in an elevated risk environment. And so what you want to consider, and this is just risk management practice guidance, okay? Risk is a function of certainty. And the less certainty in a situation, the greater the risk. The more certainty that we have, the less risk. So consider, for example, the discussion about COVID-19. How is it transmitted? What agents are effective at treating it? How long does it last or live on surfaces? Is it transmitted through the mail? All of these things increase the uncertainty about COVID-19. There's very little known or understood. It is a novel virus. And so because it's uncertain, your risk is always going to be heightened. And so as a business owner and practitioners, our best tool for managing and decreasing the risk in our practice is to create more certainty in everything we do. And developing plans, policies, and procedures, these are excellent tools for reducing risk. And if you don't have these tools in place, then unfortunately, you just don't know where trouble exists, or trouble might be coming from a risk standpoint in terms of a patient exposure, a staff exposure, some other unintended negative consequence that comes from treating patients during this particularly difficult time. So a plan, at this point you have to ask yourself, am I fully or partially or not at all providing hands-on care for a patient? And you decide, based on my risk tolerance, I'll provide a little or a lot. These policies then can be formulated into documenting your plan. Okay, and then a procedure, you want to document how you're going to execute that plan. So we're going to give you some tools. I've included a pandemic infectious control plan for the office. It's a sample of what that language should look like, and it's very easy to read, and it's intended for you to mark up to include or delete anything you don't think applies to your office, but put that into your red book or put it into your COVID-19 action plan or office policy and procedure, along with some of the CDC guidance, the OSHA guidelines for reopening. Keep all that information together, but have a plan. Don't just decide, when my phone rings, I'm going to treat the next person that wants to see me. You should really decide what is in your best interest. And things like understanding, what are my hours of operation going to be? When do I open? When do I close? what am I doing? What time do I have for lunch and cleaning? My patients, am I taking walk-in patients or scheduled patients? How many patients am I going to see hourly or daily? These things should be based on your office size, your layout, and your staffing access, your staffing ability. And when it comes to conditions, you want to ask yourself, do I want to treat everything that I usually treat? Or do I want to focus mostly on mental emotional conditions, pain-related conditions, fertility conditions, cosmetic, or all of the above? I'm not saying to what it should be. I'm just saying that you should really consider fully what your hours of operation are, so that you strictly know when you have to begin and stop your infection control aggressive policy. Plan for, how much PPE am I going to need in my office? Most facilities, larger facilities, have to provide a PPP burn rate as part of their planning. In our offices, depending on the size of your office, you want to make sure if I'm going to see 6 patients a day, 5 days a week, I need to have 30 plus reserve masks. I may need a couple of extras for people who don't come with a face cover. Go through your glove supply, go through your any other PPE that you choose to use in the office, and make sure that your planning includes understanding what is my burn rate going to be, how often am I going to have to resupply these materials. And this way you're not in a situation where you're increasing risk because you've got scheduled patients coming on Monday, you don't have PPE to provide proper care, and then your decision metric may increase your risk exposure because you want to provide care to patients, but you're not really prepared to do that in a safe and effective way. So I ask that everybody just pause as part of their reopening strategy and really get a handle on some of these questions. In your particular office, you may have more, but I think that this is really a basic place to start. And then you want to be as specific as you can, knowing what conditions you want to treat. And that may change in phase 1, phase 2, phase 3 of the opening, because again, you want to consider who's being requested to stay at home, even if they have availability for essential services, and that you're there to provide care. Is that person better off, safer off staying at home? And so you want to understand, what is your risk tolerance? This is, what chances and risks are you willing to take to provide patient care and earn a living? And you should really document this as a plan. And then you can modify your plan over time, but in the early going, stick to your plan. Identify what your risk tolerance is, define those things, and then act and behave accordingly. Okay? And then, so the last item here is screening patients for COVID-19 as part of your scheduling process. And we have some recommendations for that. And I also provided a sample patient screening questionnaire as one of the handouts. And again, it's something that you can modify in any way you want, but I thought it's a good starting point because it gives you some options for identifying risks, or people that are at heightened risk for COVID-19, can either having been exposed or having a severe complication, and also identifying symptoms. But the idea here is that you want to call your scheduled patients about 18 to 24 hours before a planned office visit. Prepare and use your screening questionnaire over the phone to identify and rule out vulnerable individuals. Vulnerable individuals in phase 1 of reopening are really recommended to stay at home. So you want to be able to identify who those people are. And I have some notes on that for you. And then decide whether or not, based on their urgency and their condition, whether or not it makes sense to defer that person for yet a little while longer or to treat them. You can decide. But use a screening questionnaire to identify and rule out vulnerable individuals and others who are encouraged to remain safer at home. You want to refer those at higher risk of infection, okay, to their primary care provider, the ER or local health department for COVID-19 screening. If you identify somebody who is symptomatic, they're on your schedule for a week, and they were fine when they called you to schedule. A week goes by, you're calling them on the day before they're coming to your office, you provide them with your office questionnaire, and suddenly they're symptomatic. Well, don't let that person just come to the office tomorrow. You know, if they're symptomatic, you want to refer them to their primary care provider, ER, or local health department so that they can be assessed and screened. And then document that that patient has been deferred to some higher echelon of care for viral screening. Okay, you know, if it's a new patient, you know, make a note that, you know, start a chart for them. Even though you don't have the rest of their intake information collected, you might just include the questionnaire so that you can document that this person was spoken to and that they were referred. And ideally, in advance of having anybody come to your office as a new patient, you're gonna, you know, either email or otherwise send your new patient documentation, have a chance to review that, you know, have it returned and reviewed before you're doing a follow-up call to screen them on the eve of their visit. Try to do as much of this in advance as possible. There's no reason to wait to the last second, unless you decide you're going to take walk-in patients, which I don't know that best practices would include that. But again, this is really based on your own risk tolerance. We talked about this already. So you want to inform your asymptomatic patients. You've called them the night before, okay, and given them their questionnaire. They don't present with any symptoms of viral infection. So you want to inform these asymptomatic patients that when they arrive at your office the next day, they're going to come at the scheduled appointment time. Don't show up a half hour early. Don't show up, late, obviously, but arrive at your scheduled appointment time. The office doors should remain locked. You want to be able to control who comes in and out of your office and when. This is just a best practice during these times. They can ring the bell if you have one or knock on the door. They're going to be greeted outside the office for a rescreening with that same questionnaire you gave them the night before, okay? And take their body temperature. If the temperature is greater than 100 degrees Fahrenheit, they're going to be referred. Again, primary care, ER, or local health department. But the same questionnaire that you gave them the night before, you're going to repeat it when the person is standing in front of you because you want to confirm that nothing has changed since last night. Okay? It feels a little bit redundant, but this is a best practice. Ask the patient to bring a face cover and a pen. Okay, when you have a chance to talk to them the night before. And then ask them to leave all personal items in their vehicle. They don't need to show up with, a big bag under their arm and lots of, personal items that they may usually carry around with them. You want them to show up personal items in the car. That includes anything non-essential to care. Their phone, their bag, anything. All they need is their pen, checkbook, cash, credit card. Okay?
Money.
Exactly. So then patients considering hands-on care. So this is important. We're going to start with patients must don, that's put on selected PPE, whatever you choose to use for personal protection prior to greeting your patient at the door. Have your questionnaire, your black ink pen, and thermometer readily available. That might mean that you have a little station set up outside your door, something so you're not picking up and putting things down, put a clean field there if necessary, but just consider that space and consider how am I going to have a questionnaire, a black ink pen, and a thermometer ready. Complete your rescreening questionnaire and take their temperature, refer if needed, okay? Have the patient put on a face cover before entering the office and immediately wash and sanitize their hands at the nearest possible location. That might be that you're fortunate to have a sink or an area right at the front. If not, you have a mobile station of some sort that you can bring there that includes at least a 60% alcohol sanitizer, preferably washing hands as well. So from there, you're going to bring your patient directly into the exam or treatment room. Okay, so there's, you really want to, we've already looked around the office and removed anything that was extraneous and whatnot. That might very well include like chairs. You turn them around, turn them upside down. This is if you have a cushioned chair that is now a porous surface, they're hard to clean. So you don't want people touching and getting all over them because that fabric is not the same as wiping down a hard countertop or some other, non-porous surface. So you don't want people sitting in chairs and things like this. Walk them right into your treatment room, conduct your assessment or examination, provide patient instructions on gowning and positioning, same thing it would do. You want to remember and revisit, if necessary, your clean needle technique, your universal precautions, that CDC reference tool for how to and sequencing for your donning and doffing any personal protection equipment that you're going to wear. Okay. And so again, I put in here a reference to that sequence poster, and the CCAOM also did an excellent job of taking you through contacting your patient at the door, bringing them to your exam or treatment room. And I'd urge you to go ahead and read through their infection control policy, because it gives you some additional step-by-step guidance here. Hands-on care. So recommended minimum PPE use during patient encounter. So we have a minimum standard of care, and that is, at this point, for providers, a surgical mask. It doesn't have to be a respirator, but it has to be of a surgical mask quality, which is going to be of a greater protection for respiratory secretions than just a face cover. Something that is recommended as a surgical mask, okay? Or greater. If you have an N95 or a KN95 or a respirator, mask, shield, you can wear Darth Vader outfit if you want, to protect yourself in this instance, but the minimum standard is a surgical mask. Providers also are wearing medical exam gloves. Patients have at least a face cover or greater. And again, if patients want to come in with, gloves, a surgical mask, respirator mask, anything that provides them greater protection, and also it protects you and it protects them. Okay. And so I would say that if they want to wear additional PPE, it's acceptable, to the extent that you can access the area that needs to be treated for the person. Medical waste standards for PPEs. I spoke with SteriStyle in advance of preparing our presentation tonight, just to double check with standards in Florida, and there's no additional management or storage or disposable requirements mandated by the state at this time for materials that are, PPEs that are not classified as biomedical waste. So we're operating with the assumption that there was no blood splash, blood soaking, contact with bodily fluids, anything that would convert that PPE from regular municipal waste to biomedical waste. If something happens along the way where it now becomes reclassified as biomedical waste, then it has to be managed like biomedical waste. But under normal circumstances, if nothing like that happens, it can be disposed of. Now, from a best practices standpoint, I think it's important that everybody should include applying an approved spray disinfectant on all post-care materials that are being collected or hauled to a municipal trash site, which means if you have gloves, mask, any PPEs, other materials that you're disposing of, either in between patients or at any time, is you may just apply that disinfectant spray to those materials well in the bag. Spray your mask, spray your gloves, spray, anything that's in that bag. Just give it a once over with that disinfectant spray. And, certainly I go back to the risk and the uncertainty question. Right now, we're uncertain about the risks of transmission with COVID-19 or the implications of discarding some trash items that may have come in contact with these airborne particulates or spores. And I think in the interest of protecting municipal sanitation workers and not having a large collection site somewhere in your community with thousands of pounds of COVID-19 waste, take a second, spray down that bag, spray those materials, and then we know, at least when they're leaving your office, we've taken responsible steps to minimize any potential for transmission after that material leaves your office. So hands-on care, whenever possible, you want to avoid positioning patients prone. And I know a lot of us that treat back pain and neck pain, we're used to doing this with patients, but choosing to treat them lateral recumbent or in some other way may be a better choice because we want to minimize nasal and buccal mucus and saliva loss here. Drooling and things that are common to, releasing of mucus and saliva from the body during treatment. You don't want a collection of that on the floor, and then you're cleaning your floor anyway, but it's another risk and another exposure. So as best possible, maybe consider supine and lateral recumbent treatment options. Patients should always be required to wear a face cover when facing or speaking directly to the provider. And this is very important. If you're having a conversation or examining somebody and you're face to face, there's no reason for them not to have a face covering on. And this is going to protect you in the event of some spontaneous emission through sneeze or cough or something like this. You want to make sure that you don't open yourself up to that mistaken option. Keep them covered when you're face to face. Face cover removal during treatment should be avoided, but this is a case-by-case decision. And there are foreseeable examples of when you might do that, and I just remind you of your provider risk tolerance. So ideally, if somebody is lateral recumbent or supine, they're breathing comfortably through their face cover, there's no reason to take it off. If for some reason it's not comfortable or it interferes with treatment, this will be a case-by-case example. Based on your own risk tolerance, the design and setup of your treatment room, the position of the patient, you can choose to allow them to remove that. Following treatment, the patient should dress, sanitize their hands, and remain in the room until met by staff or other provider for payment and booking of appointments. Okay, so payment and appointment making. The payment transaction should be organized and simplified to reduce patient movement in the office. When possible, conduct that transaction and appointment scheduling in the exam room. Otherwise, if it can't be done there, you can bring them to the appropriate area of your office. But ideally, you're able to make that appointment in the treatment room, minimize the area and the locations that the person is moving in the office, and then escort the patient to the exit, opening and closing and locking the door for them. Okay? That's how we want to manage our patient movement. Office maintenance. So you've had patient come in, you've treated them, they've left. You want to use gloved hands to remove table paper, linens, gowns to appropriate trash or bins, okay? Don't just reach out and pick up that material. You want to maintain your barrier. So use appropriate washing and disinfecting products to clean the treatment room. This, of course, includes the bed, the floor, the light switches, doorknobs, and any other non-porous contact surface. And you want to use and apply the products according to the instructions and adhering to the effective contact time needed for the product to disinfect the surface. So make sure you plan your time. If you have choose to purchase a product that has a 30-minute dry time, then that's going to obviously affect how you're scheduling and turning over your treatment rooms, okay? So you want to create and complete a daily office maintenance log that records cleaning of all office areas. And on your log, you want to make sure you have, a column for for when, what time was it done, what part of the office was cleaned, what cleaner was used, was it a disinfectant situation, or was it just some soap and water on dust and grime in the corner? And then who cleaned it. So sign off on it. And this isn't meant, you don't have to be overly technical. It's just open a Word document, put in, 25 lines with 4 or 5 columns that can accommodate this data. And you want to have this either as part of your Red Book or your COVID-19 policy and procedure book. And each time the cleaning is done for a treatment room, other area of the office, it's logged and recorded, documented, and put in that log. Very important that you do that, especially if somebody from the Department of Health or elsewhere is reviewing your policies. You want to make sure that you have documentation of those types of things. Personal care for providers. Now, this is important. So providers should choose work apparel that's durable and easily washed. If you're not wearing a full disposable gown cover, which is not required in the minimum standards here, I'm just saying if you're not wearing a full disposable gown, you want to avoid clothing that has exposed drawstrings or extra pleats or extra fabric, things that are loose hanging that can attract fomites or aerosol viral particulates. You want to avoid wearing hand and other jewelry. You know, if you're wearing a simple band or something under your gloves and that doesn't interfere with you donning or doffing them, that's fine. But, you know, avoid wearing anything that's going to, you know, that's going to catch on your own PPE or attract hard to clean materials, okay? You want to make sure that you cover any skin abrasions. If you have any scrapes or open breaks in the skin, make sure that they're well covered. Store several changes for scrubs or apparel in the office and be prepared to change your apparel when needed throughout the day, okay? I don't know if we could say that, you know, best practices that you change how often. This is a provider discretion question, but you want to be mindful that if your patient is wearing a mask at all times when they're facing and speaking to you, that's going to minimize any transmission of particulates onto what you're wearing. A lab coat may be helpful if you're not wearing a disposable gown. If you're wearing a lab coat, it's best that the lab coat stays in the treatment room and not worn throughout the office. I say that, I think I saw that guidance from the CCAOM, and they make some references to lab coats. But be prepared to change your clothes. You know, if anything out of the ordinary happens, or you think that there's some sort of transmission of particulates, you want to make sure that you're protecting your next patient, protecting your patient. Follow the CDC and the CCAOM guidance on frequent hand washing and sanitizing. There's many, many examples of when and how to do that. And then complete and document self-exam and office screening questionnaire daily. This applies to you. It applies to your staff, anybody that's healthcare personnel. But it's important that you do that, you document it, and it's kept in your COVID-19 policy and procedure book somewhere where it can be accessed daily. And for how long are we going to have to do this? You know, I don't know for sure. But for the foreseeable future, you should have a daily questionnaire if you're treating patients that you've answered and signed, okay? And then obviously get some rest, avoid immune suppressing habits, and get outdoors and see the sun. We need care, and we need to be mindful of our own health and welfare as well, both mentally, emotionally, physically, spiritually, to be able to bring our A game to work every day and, you know, provide the standard of care that we're accustomed to. We need to be at our very best. So I want to invite Marilyn Allen, who's on the line, to add comments on any errors, omissions, or anywhere where she feels like there's additional input. And Ms. Allen is a subject matter expert on complementary and alternative healthcare professions. She serves as an editor for Acupuncture Today. She regularly speaks at associations, including FSOMA, visits schools and regulatory boards to speak on topics affecting practice management, risk management, and ethics, all of which is very important to the conversation we're having tonight. And she's also the current liaison to the World Health Organization for the International Classification for TCM Committee, and a U.S. delegate to the International Standards Organization Technical Advisory Group. And these people set and evaluate the standards for equipment, materials throughout the healthcare industry. And so at this time, I'd welcome Marilyn to add any comments to the discussion about practices, hands-on care at this time.
Good afternoon, David. That was an outstanding presentation. The first sentence that I want to say is, and we've been receiving a number of calls from our insureds daily about, would I be covered? We have not made any changes to the policy. Yes, you would be covered. The particular question that people ask is, well, what if someone comes in, I treat them, and then they come up with COVID-19 and they say we gave it to them in the office. Well, I think if you do all of the things that David has recommended and you document it, I'm going to say right now, probably documentation is the number one issue that you are going to have to be able to prove. Now, let me also say this. This has been as hard on other medical providers as it has been on acupuncturists, but also let's not forget all of the attorneys that have not been working as regularly as they could have, or even the court systems. So documentation is going to be the number one thing that helps you. When you do, and if you do decide to open, you need to do it gradually. And we are working on a consent to treat for COVID-19. We should have that ready by the first of the week. And we'll be happy to send that out. David recommended that the most important thing is you are in legal compliance. If you're not in legal compliance and you are disobeying regulations, then there would be questions about coverage. So think about the timing of when you think you might want or consider to opening your office. Reach out and call your patients. Went to a marketing seminar not too long ago, and they said the most important thing is to reach out to your patients, to your clients. Not text, not email, not Facebook, LinkedIn, just pick up the phone. And I've done that. I've tried to call 5 people a day, and it's amazing to me how many people just thank me for the call. But if you're going to open, say, 2 weeks from now, let your patients know that you are going to be open. Give them a 2-week notice. And then you give them a 1-week reminder. You might also want to talk to them about the flow that you're going to have in the office. Let's say, for example, you're going to do 1 patient an hour. You want to tell them how you are sanitizing and what the spacing is going to be. Let them know that when they come to the door, if you've decided to lock the door. It's recommended that you don't hoard, but be prepared with all of the things that David recommended. Have ample supplies, because you want to be sure that you are safe, as well as your patients and staff. So you want to have a protocol, a procedure. It needs to be written down. So if anything would happen, like in a court of law, this is my procedure, and we followed it to the letter for every single patient. The issue is sometimes there might be a silent carrier. If that patient notifies you later that they have contracted COVID-19 or they've tested positive, you, as the provider, are required to notify every patient that you have treated or a person that you have come in contact for the last 14 to 21 days. You have to let them know that has happened. You might want to consider having a sanitation station somewhere. As David said, it could be portable. So when the patient does come in, they can easily wash their hands, or if you want them to wash them outside the office. You probably want to look at how you are documenting your treatments. Document them, everything that happened, everything the patient says. This is probably one area that acupuncture really needs to work on, is our documentation. Because if there would be any type of an adverse event, your documentation is what will be your representation. I want you to think seriously about when, if, when, and how, if you're going to open. Listen to what your authorities say. Call your professional association. And we wish you the best. Keep yourself and your family safe. Do you have any questions, David?
No, thank you very much, Marilyn. That's a big help. I thank you for the input.
I do have a couple of questions, David. I don't know if you got my text with them.
I did, but I was going to jump into that. And I'm open to Ellen if you have some feedback on this as well. But the question was handling a couple of aspects or elements of our patient exam. That includes tongue and pulse. And I would say two things. One, if I were to, under most circumstances, unless it was the most rare of circumstances, personally as a provider, and I'm going to give you my best thinking on it, and then as a profession, you have to decide what works for you guys, or we could look for additional guidance from the CCAOM. But for evaluation of the tongue, it's one of the inputs that we seek for making a determination about a differential diagnosis. It's not a determinative one. It's meant to be one of several clues that we seek input on in order to make a determination. And if I had to choose between observing someone's tongue for a low back pain treatment and having them remain with a face cover on, I would choose to leave their face cover on personally as a provider. If you think that it is materially necessary to make your differential diagnosis, then maybe you could consider, if you're familiar with why they're being treated, or if you've been treating them for a while for back pain, you could have them take a picture of their tongue and send that to you. Have them take several pictures if necessary, so that the lighting is proper and you can get an indication of what that tongue looks like. The second thing was what about pulse or palpation of the body? And again, I think in this instance, I would probably do pulse with my exam gloves on. I'm not going to touch, break my barrier with the patient or my protection with the patient to do pulse. Again, like tongue, it's important, and I respect and understand the importance of it, but it's a single factor and not determinant necessarily. And again, depending on the condition that you're treating, I think that if you can glean proper pulse with your exam gloves on, then I would go with that. And again, if that was not possible for some reason, either an extreme faint case or something like this, again, it would be a case-by-case basis where the provider would make a clinical decision in the room at the moment that's specific to the way that patient presents. Abdominal palpation or palpation of any other type of the body, I would be consistent with my using exam gloves. Ellen, those were the 2 or 2.5 questions that we had related to that.
Yeah, I'm answering one about gua sha. If the patient's masked and facing away from you, why not do gua sha?
I'm not saying that they can't. There's no limitation necessarily on that.
Right. Let's see, I'm not.
Yeah, I mean, our standard manual therapies of the body don't need to be, curtailed. I would just remember though that you're going to disinfect that piece of equipment. Not that we have those responsibilities, in between patients anyway, but you're going to make sure that now you're going to expose that to whatever your disinfectant agent is.
Yeah.
David,
There's a question about face shields.
Yeah.
And my thinking is with face shields, they don't really protect you from airborne particles if they don't seal off your face. So a mask is better. The face shield's more if you're having somebody cough on you or spit, is flying around. But you can answer that differently if you want.
No, I agree. You're right. It's not a facial shield is not designed to protect airborne particulates. It's really designed for splash, whether it's a spittle or some other exudate that comes projected out of the body. It's designed more for that. But I think again, the minimum standard in our case is a surgical mask. If you have a reason to think that you feel more comfortable for one thing using a face shield, in the office and you think that it's important for either your patient or yourself, then I welcome that. I think it's a good idea. I also go back to what I said before. I think it's a good idea that you have at least one, okay, and preferably it would be a supply of, but at least one shield and one disposable gown in your office that is part of an emergency response kit. You know, and you need to be able to, should be able to, okay, I say should be able to demonstrate that you were prepared in the event of something out of the ordinary to protect yourself and your patient with enhanced PPE. Okay, you don't have to have a closet full of it. It doesn't have to be used on every patient. But I think, you know, the responsible thing as part of a best practices plan is that you can at least demonstrate and point to the fact that it's in the office. You have, you know, it's available to you at a moment's notice if needed. Okay.
I agree. David, I want to add one thing.
Yeah.
You said that patients need to leave things in their car. I recommend that when the patient makes the appointment, that you remind them to leave all extra things at home. If they are going to put them in the car, they should put them in the trunk so it isn't seen if someone walks by, because we are having a lot of what they call smash and grabs in the insurance industry.
Yep.
And the one thing that will attract that is either a purse or a cell phone if somebody can see it. So tell them to be sure that that goes into the trunk or left at home.
Excellent. Excellent idea. Yeah. You don't want to set your patients up for, you know, a loss like that. So
Exactly.
I've got a couple more slides and then I'll open up to general questions. So as a general reminder, I put this slide back up in that I want to remind everybody that the major goal for the acupuncture profession, for, you know, any opportunity that we have to advance as a profession is really only achieved through self-governance and voluntary compliance. And the reason I said this before, I'll repeat it, is that when we develop our own policies and we comply voluntarily with regulations, the reason we do that is so that more regulation is not required to control our behavior and force compliance. Then we have other either provider types or regulators making decisions about, you know, what's best for acupuncturists. And so long as we're responsible enough to self-govern and comply voluntarily, then that speaks well for the profession as a whole, and it makes life a lot easier for people who are expanding options and access for acupuncturists. Okay, so we try to minimize as much bad actors as we can here by self-governing and self-regulating. So I also wanted to just give you a quick list of the things that were included for downloads at the end here. And there's 7 or 8 things here. First is I've included a sample language for an office COVID-19 pandemic infectious disease policy. And this would be the policy, the overarching policy for your office. And then from that, you can develop some specific procedures that may be necessary and specific to you. The next thing is a patient screening questionnaire. I provided an example of one, like I said, add or subtract from it. Marilyn mentioned the third item that they're working on, but I have one here included as a sample from our attorneys that was prepared. It's an assumption of risk and waiver release for treatment in your office that's specific for COVID-19. This is a sample that's suitable for practitioners. They can just put it on your letterhead, have every patient sign it. I included a PDF version of the CCAOM Infection Control Advisory, a PDF of the EPA approved disinfectants for healthcare settings, a PDF of the OSHA 10-step to reduce spread of COVID-19. That's a poster for your office. It's a nice, pithy 10 steps, very straightforward. And again, the OSHA guide for preparing workspaces. This is, like I say, about a 35-page document, but there's only maybe 6 pages in the middle of it it's all worth knowing and reading. I'm not saying not to do that. But if you wanted to photocopy that or print that, put it in your COVID-19 policy book, but be particularly mindful of the middle sections that have to do with cleaning and things that are specific to preparing offices. And then lastly is it's a 1-page that has
Yeah, I've also got the PowerPoint and a PDF of the PowerPoint and a list of all the links that were in the PowerPoint, because if you don't have PowerPoint and are trying to use the PDF, the links don't work. So the links are all in a separate document that are in this PowerPoint.
Thank you, Ellen. So again, I want to thank everybody for joining our town hall meeting tonight. I want to, and a special thanks to Marilyn Allen, of course, for participating, sharing, some of her vast knowledge and experience. The PowerPoint, Ellen said, is available. Presentation was recorded, so if there's something you want to go back and hear again, you're welcome to. Or if somebody that wants to view it at a later time, they can review the recorded one. Ellen has the documents available for you, and then you can send email questions to me at david@fsoma.org. david@fsoma.org, or you can share some comments now. And if there's any questions, I know we ran a little bit longer than I expected, but let's field a few questions if you think that's appropriate, Ellen. Otherwise, they can send emails and we'll get back to you over the weekend or as soon as possible.
Okay, looks like some people have maybe put questions in the Q&A, even though I needed them in the chat. So let me check there. I just posted the link for the survey. It's kind of a, what'd you think of the class, but you also will be sharing with me your AP number and your NCCAON number. So fill that out by tomorrow or by the end of the weekend, and I'll get you a PDA for this.
How many PDAs do we have?
Just one.
Good. That's good.
Go over, but yeah.
Excellent.
Okay. There's some questions about the PowerPoint. It is in, I've been putting the link to it in the chat, and I will post it tomorrow when I post the video. But it's the Dropbox link, has the PowerPoint, has all the downloads. So those questions are answered. What do you suggest between washing treatment table sheets with bleach versus using disposable exam table paper?
Oh, you need to use paper.
Yeah, I'd say you want to use a disposable paper, or your regular linens that are laundered with is okay. But I think
you have to wash them every time. You can't.
Yeah, no, of course. Maybe if you have a top sheet linen or something like this, that as long as, but again, remember, you've got gloves on when you're removing, the linens from the table or the paper from the table, any gowns that are involved. I think, choosing either or is fine, but you want to make sure that you're stripping the table completely between patients and using an approved disinfectant on the table.
Yeah,
and when you fold them so that the portion that touched the patient is inside, because you recommended spraying the disinfectant over, but fold it so it's all completely inside. Same thing with taking off gloves. Fold it so you pull the glove off and it's all inside. We don't know where all these little creatures are.
Correct. So yeah, Marilyn's absolutely right here. And I think one of the CDC pop-ups that I have for you guys includes both donning and doffing for personal protective equipment, as well as for managing patient laundry. So yeah, the idea is you want to sort of pull that in on itself in such a way that you're not exposing any surfaces that the patient was laying on to the outside. You want to ball it up like you're making a dumpling or something with the portion that was exposed to the patient on the inside.
There's some questions about isn't how is wearing gloves better than proper hand washing, and don't more needle sticks occur with glove wearing?
No, I think the challenge is, and then as a provider, you know, we've provided best practices. If you have a struggle managing your needling technique while gloved, then obviously choose the safer option there. But ideally, the CDC guidance that we're getting on healthcare providers and all healthcare treatment settings is that you're using universal precautions, and that includes glove wearing. So there's a redundancy, you know, to our way of thinking when it comes to hand washing and on top of gloving, as well as their recommendation of using 60% or greater alcohol solutions before and after putting on gloves, which again, I think manufacturing standards sometimes are concerned about that degrading the quality of the material that the glove is made out of. But this is the guidance. And my recommendation would be that if you're practicing, you want to adhere to the recommended guidance and regulations.
I'm having trouble, for some reason, people are,
Let me defer to Marilyn real quickly on the clean needle, pardon me, on the CNT and the hand washing question. You know, I'm familiar with the data on hand washing versus gloves and all of that as well, but what's your take on supplementing one for the other?
I wouldn't supplement, I would do both. But here's the thing, I think when you take your gloves off between each patient, you wash your hands.
Yeah. I mean, how about
there are different kinds of gloves. Find gloves that fit you. Look at the doctors. When they do operations, they use surgical gloves. The same thing when the nurses do shots and things like that in the hospital, they have on gloves. Find gloves that fit you. I bought a box, and they were so tight on my hands, I had to go and buy the next size up. So they come in small, medium, and large. You know, they come in clear. And I know there is a great deal of philosophical discussion that you can't find the chi with the gloves. Okay, we'll let that go. But I also think that we do not have evidence yet or data showing that there are more needle sticks with gloves than without. So you just have to be careful with the needles. I think at this point we do things slowly in compliance with all the regulations and things that you have talked about. I think it isn't just about thinking about one patient, but I think we also have to think about our responsibility to our staff, yourself, your family. You also have a responsibility to the rest of the profession. You represent the rest of the profession. So as you are doing and keeping yourself safe, and that reverberates throughout the profession, we want to be, as David says, self-regulated.
Thank you, Marilyn. I agree. I think maybe fitting is something that has to be solved. Make sure that they're the appropriate size, and different materials are more or less slippery or difficult to manage the needle with. So finding the right tool for the right equipment that meets your particular need is important. But you have to back up again to the first area that we covered, which was government regulation. Permission, if you would, to perform dry needle, permission to perform acupuncture and needling is completely dependent upon our ability to comply with the CDC and OSHA guidelines. That's the only condition that the government has put on healthcare providers, is their ability to comply with those guidelines. So to answer the question about gloving and not gloving, is that sort of solves the question. If you're unable or unwilling to do it in that way, then you're not meeting the regulation as it's currently written. You know, maybe they may drop some of the more strict CDC requirements going forward, or CDC guidance going forward as we get into phase 2 and phase 3 and beyond. and then there won't be any discussion, and we'll have the option of using gloves or not using gloves. But right now, the performing the act of acupuncture and the service of meeting patients' needs is wholly dependent on the provider's ability to comply with the CDC requirements and OSHA requirements. Okay?
Yeah, you know, people are asking about things like Bell's palsy and needling the face. You know, if you have to needle a face point that's under the mask, then, you know, you do everything else and maybe at the very end do that. The main thing you're wanting to avoid is sharing any kind of breath with the patient.
Right. Again,
Infection control.
to me, all of these questions are individual clinical questions. They're determined on a case-by-case basis. And I think that the provider has enough information, you know, given what the CDC is asking for, what the standard of care is. And again, if you choose to deviate from that for some reason, and you have a clinically relevant reason for doing it, you're treating a patient and there's no, you know, feasible way to provide care in a way that's prescribed in the guidelines, and you're going to deviate from that, there's not saying that you can't deviate from it, but you need to be able to document, and I say you need for your own purposes, to document exactly why your other standard of care could not be met, why the circumstance demanded a deviation from what's recommended. And I would put things on it exactly like, you know, how long was it for 3 minutes? Was it 10 minutes? Was it for 20 minutes? You know, exactly, you know, where that deviation from the standard happens, exactly why, and for how long, and, you know, how there were, you know, cofactors that just made it impossible for you to meet the standard of care as described in, you know, in the best practices here or by the CDC elsewhere. I'm not saying it can't be done. I'm just saying that when you feel like you're veering away from that standard of care, that's when you have to say to yourself, I need to document this as clearly and concisely as possible and make the argument as to why no other option was available to me at this time.
And be sure to include the time.
Yeah. Include the time, you know, it's, you know, because otherwise you're assuming you're on a straight line, you're following all of the best practices, you're following all of the guidance, but you're going to step off of that path for a specific reason. Yeah, you want to be able to provide as much contour and shape and description to everything that went into that, and then you went back onto the, you know, the, like, again, the standard of care and following the practices. So you're able to identify it in as exact a way as possible.
Okay, some people apparently are having trouble with the Dropbox link. If you go to FSOMA.org, well, let's see, I don't know what's going on. I will work on that. I'm going to post it on the homepage of FSOMA.org. You scroll down to the image for this workshop. We will get them posted by tomorrow, if not tonight. I'm not sure why it's not working. So let me go into Dropbox online and see if I can get a better link.
How are we doing on time, Ellen?
Oh, we're way over.
It's okay. It's what time?
It's 8:30 almost.
Okay.
So if you can you get in and look at questions or chats and see? I'm going to try to get into
Let me see.
Dropbox and see if
Well, I would say, let me, on Q&A.
There's Q&A and also the chat has some.
Okay, so do me if it's, I want to be able to sort of cruise through those. So Ellen's going to send me the link, and let's do this. And I think I'm going to, because it's hard for me to review those and then pick and choose and answer what's been answered and what hasn't. But every single question is important, and anything that that has not been answered already in this discussion, I'll provide a response to. Okay. And I'll do that over the weekend.
Yeah, it looks like there may be a problem with Dropbox, so I will get this posted on the website as soon as I can. And
well, same thing. You know, we'll get that resolved, and we have other ways to share to share those files. So if there's no other questions that we're going to address directly.
Yeah, I think most of it is like about hand washing versus gloves, and it really, we're giving you what are the guidelines.
But those are the guidelines, you know, and I think Marilyn said it best, both. And if you read in the guidelines, it call for both washing, sanitizing, and gloving. So you want to proceed as cautiously as possible. You want it, the optics of this are important, as well as the data and the science. You know, if these are the guidelines and they're supposed to be data driven or scientific driven, that's the standard of care during this point in time. Again, the only requirement that the profession has is to comply with the CDC requirements. And like I said before, self-governance is about voluntary compliance. So long as you're voluntary complying, then you're going to get left alone. If somebody wants to call you out because you're not complying with the CDC guideline, then maybe you won't be self-governing anymore. Somebody's going to tell you what to do. And as a profession and as an individual, I don't want that. So I think it's best that you find the equipment that works best for you, and you find a way to comply.
All right, well, thank you, David and Marilyn, for being here. And we'll see if we can't get the answers out there too, if there are any we haven't covered. Please look for links and a copy of the recording going up tomorrow. It takes a little while for it to process through Zoom. And I am trying to find out, Dropbox is not letting me sign on, so something's up with them. So I will get that out as soon as possible.
Sounds great. Hey, I want to thank everybody for participating. Thank you for your questions. And if there's anything that occurs to somebody after the fact, feel free to email me at david@fsoma.org, and I'll get back to you personally. Thank you very much, everybody. Have a good night.
Thank you. All right.
Stay well.
All right.